Are you a good candidate for a breast reduction, and will insurance cover it? This is really the crux of a matter during a breast reduction consult. And so I wanted to sort of make a detailed video here about what exactly we look for in a breast reduction candidate, and then what insurance looks for in terms of overall coverage. So first of all, what do I think of when I think of someone who is a good candidate for a breast reduction? Well, this is someone who comes in, obviously, who has large breasts that are usually hanging a little bit low. And this is creating typical symptoms of women who seek breast reductions. And what I mean by this is you may be complaining of back pain, either in the lower, middle, or upper back, even neck pain, some shoulder grooving that you can see on physical exam, or they may have things like under breast rashes that bother them from time to time. The truth of the matter is most women have almost all of these symptoms. And one of the things that I usually kind of allude to is that this is really a limitation in activity of daily living, meaning these are things that are preventing you from living your normal life. So whether or not you are fitting in clothes, whether or not you're able to exercise religiously because you have all this pain and the limitation of very large breasts. These are things that I look for in breast reduction candidates to determine whether or not you would really benefit from having your breasts reduced. Now, how does breast reduction help with all these things? Well, the obvious answer is we're reducing the weight of the breast, right? I mean, the more weight we take off, the more symptoms will improve. But really, the main thing that I feel like helps in a breast reduction is not just the weight removal, but the actual lift. So every breast reduction also is a version of a breast lift. We're actually raising the breast on the chest wall to alleviate some of those symptoms. Now, the obvious one is that you won't get as much under breast irritation because your breasts are higher and they're not falling over your abdomen. But in reality, raising the breast also raises the center of gravity and decreases the pull on the neck and back. So it's not just about weight reduction, it's also all right, now for the million-dollar question. Will insurance cover my breast reduction? It's important to first note that every state is a little bit different. So I'm going to talk specifically about which options are available in Alabama. In Alabama, we'll either go by about 500 grams per breast, or 1,000 grams total, or a criteria called the Schnur criteria if your height is under 5'3", which is really more of a calculation of your BMI to breast ratio. Now, there are a few exceptions, but unfortunately, they are really few and far between. If you do not qualify by those two things, unfortunately, most of the time, even if you are symptomatic, insurance will not cover the procedure. One of the things that is important to keep in mind is that just because insurance doesn't cover your procedure doesn't mean that it won't help tremendously. Many times what women hear when we say that insurance is not going to cover the procedure is, well, you don't think my symptoms are severe enough for a breast reduction to help. It is quite the contrary. Just because insurance doesn't cover your procedure doesn't mean that you may not benefit massively from a breast reduction procedure. Again, there are lots of things that help, from the reduction of the weight to the lifting of the breast. And most women, even if insurance doesn't cover it, get a huge relief from getting off maybe 200-300 grams and sometimes even 100 to 150 grams with that breast lift to alleviate their symptoms. Now, your surgeon may have different names for this. Then they may call this a non-insurance covered reduction, a cosmetic reduction. Some surgeons even term it just a mastopexy, since insurance isn't paying for it, mastopexy being another term for breast lift. No matter what your surgeon calls it, please don't think that they are dismissing your symptoms or that they don't think that performing this procedure will help your symptoms. I promise you that we have very, very few patients that get this procedure that are not happy and don't have an unbelievable benefit from it. So if after watching these videos, you think you're a good candidate for a breast reduction, come in and see us for a consultation. You may also be interested in some of our other videos that describe the breast reduction technique, the resulting scars, and the recovery from a breast reduction. It's important to become educated and ask your surgeon about these things, because remember, it's your body and your results that matter.